Okay, I'm going to talk a little bit about AC joint. Sprains are certainly the most common thing that therapists are going to see in the clinic. Usually the result of a direct fall onto the shoulder, an axial load through the lateral shoulder that drives the acromion underneath the clavicle. The severity of the sprain is graded or typed according to which ligaments are involved and how much instability there is. So if just the AC ligaments are sprained, it's considered a type 1. The joint is intact, the joint is going to be stable. If the acromioclavicular and the corticoclavicular ligaments are involved or sprained, the joint could be said to be subluxed, and that's a type 2 sprain. Types 3 through 6 involve a complete rupture of the AC and the corticoclavicular ligaments, and then the joint said to be dislocated or separated. And there's some debate on how to treat type 3, whether non-surgical or surgical. I'll touch on that in just a little bit, but then types 4, 5, and 6 need to be treated surgically for good outcomes. In terms of how these patients present, they notoriously will report that they're having pain right over the AC joint or into the upper trapezius. So that's a pretty predictable and common pain pattern. Back to the type 1, with that, again, you have mild overstretch of the AC ligaments. The joint's going to appear normal outwardly. The alignment's going to appear normal. If they have radiographs, those are going to be normal. And if you do any kind of shearing or stability tests of the AC joint, those are going to be normal as well. With a type 2, the AC ligaments are going to be ruptured. The corticoclavicular ligaments, the conoid and the trapezoid, are going to be stretched slightly. So there's going to be some elevation of the distal clavicle and some play in the AC joint, more so than in a stable situation. And then with radiographs, there's going to be slight widening of the joint. That's a big distinction between type 1 and type 2. So with both type 1 and type 2, the pain is going to be localized to the AC joint, like I said previously. The patient's typically going to have pain with a variety of different motions, particularly with elevation once the AC joint starts to move. And one of the hallmark findings that I have seen with this is pain with horizontal adduction, so just bringing the arm across the chest. That's usually quite painful for people with AC joint sprains, and I found it to be one of the last movements to return pain-free as they resolve from a type 1 or a type 2 sprain. Okay.